Hey guys, I'm Dr. Nilima. I'm a gynecologist, and today, on the occasion of World Menstrual Hygiene Day, I'm here to tell you something about, obviously, menstrual hygiene. All right, women's private parts, all right, are aligned like this. That is the urethra, that is the vagina, and that is the anus. This is where you pass your urine from, this is where the menstrual blood comes out from, and this is where you pass your stools from. So please understand, all these areas are very, very close to each other. Whenever you are having menstrual blood coming out, please understand that menstrual blood, all right, is a very good medium for bacteria to proliferate. So absolutely important aspect becomes menstrual hygiene, right? Urethra is very close by. This can get infected very easily because the female urethra is very small as compared to the male urethra, which is as long as the penis is. Now you pass your stools from here. So whenever you want to clean yourself, you always clean from top to bottom, never the other way, because this is a soiled area. You don't want it to come here and infect either the vagina or your urethra. Okay, so menstrual hygiene becomes extremely important. Whatever products you utilize for collecting the menstrual blood, please remember that you're going to use your hand for it, so keep your hands absolutely clean. The most common product which is used is the pad. Either it can be a cotton pad or it can be a gel based pad. All these two things you put in your underwear and then you wear it on top over here, right? Pads have to be changed the moment they are full or within 6 to 8 hours. 8 hours definitely, even if your pad is not full, because like I said, little amount of blood also is enough medium for bacteria to proliferate. Now we have something more special than that, is a tampon which you use to put inside your vagina. It comes in a packet like this, large, medium and small, depending upon the capacity, depending upon the amount of blood flow that you have. It comes in a packet like this. Plastic इसका निकालना होता है, इसको अंदर डालना होता है. So this is one I have opened up, and it goes inside your vagina. There's a string which comes here, and when your pad is full, okay, you are supposed to just pull the string out, wrap this in a paper, and then dispose it off. All these three things, that is the pads and the tampons, need to be wrapped and disposed separately, okay, as a biohazard or a bio waste. And this goes in a separate waste paper basket with a lid, because menstrual blood can land up having a lot of foul odor. Okay, so the disposal becomes very important. One very, very important new discovery which is coming, or a new thing which is coming, which you need to be aware of, is the menstrual cup. Now, what is a menstrual cup? A menstrual cup is something like this. It is made of silicone, and it is a completely non-allergic kind of product. And what you need to do is wash your hands as usual, and first time when you're inserting this, you need to boil it in water for about 3 to 4 minutes, then take it out, dry it off like this, and insert this. There is a method of inserting this inside. You have to pinch it over here like this, and then insert it inside and let it go, and just it pops up and it catches hold of the cervix, and the blood gets collected in the cup. 10 to 12 hours is what the collection in the cup can hold. And when you want to take it out, you have this tip over here. You are only supposed to twist it a little bit, twist it on that side, press the cup a little bit so that the suction gets removed, and then take it out very gently like this, okay, so that the blood doesn't spill off. Whatever blood has been collected in this, dispose it in your commode or in your basin, and wash this thoroughly clean with soap water. Clean up and take off all the soap water also, dry it, again reuse it. So this is the only product which does not add to the biomedical waste. Okay, so you should not be thinking now more in terms of the pads or anything, but you should be thinking more in terms of menstrual cup, which is environment friendly. Disposing this becomes a very big problem. Every day there are millions of women and crores of women who are menstruating, and every day this is thrown into the waste paper basket and becomes a major chunk of biomedical waste. Alright, so you need to incinerate this. Incineration का मतलब ये होता है heat it at very high temperatures so that everything gets converted into ash, and ash is sterile and ash can be disposed. So use hygienic products, but when you're using hygienic products, see to it that your hand hygiene also is maintained at all times. Cleaning the area when you're changing your pad, or when you're changing your cup or your tampon also becomes extremely important. Just wash yourself with nice clean water from top to bottom, never the opposite way. Dry yourself, dab with a towel and dry yourself, and take the fresh piece of pad and apply it to your underwear and wear your underwear. All right. Disposal, like I said, has to be separately. It has to be covered in a newspaper or in any other paper, and then sent and then disposed of separately. So please remember that do not add to the biomedical waste. Try and use the menstrual cup as much as possible. Sizes are available. People who have never delivered vaginally find it very difficult to use this, so you can use the smaller cup, but people who have had vaginal deliveries can use a larger cup if their flow is larger. So the cup not only depends upon the mode of delivery that you've had, but it also depends upon the amount of flow that you're having. But if you've not delivered vaginally and you're needing to use the smaller cup, what you could do is use a panty liner along with it, so when it spills over, or the tampon also fills over, you will get a stain on your pad and not on your underwear, and you know it is time to change your tampon, or it is time to empty your cup. So please remember this. And do not worry, women menstruate because they are fertile and because they are young, and it is just an expression of the ovary. The uterus happens to be the spokesperson of the ovary. So as long as your ovaries are functioning well, you are going to menstruate. So menarche to menopause is when you menstruate. Accept both the phases in your life as you would accept anything. This is normal physiology. Normal menstrual blood is not dirty blood. It is blood and the uterine lining which gets shed at the end of every menstrual cycle. A constant intermenstrual period and a constant number of days of bleeding for a particular woman remains the same, and that is normal. Any change from your normal is abnormal, and you need to go and see your gynecologist. Menstrual hygiene becomes extremely important to prevent infections, and infections can happen in the vagina, and it travels up through the cervix into the uterine cavity and through the tube into your pelvic cavity, and can cause complete loss of tubes and loss of patency of the tubes, and it can cause a lot of adhesions in your pelvis and give rise to more amount of menstrual pain and further fertility problems. So menstrual hygiene again is a very important part of life. Please learn menstrual hygiene and teach to other young children who are just entering their puberty, so that they pass through their entire fertile period without any infections. And if you do land up getting infection, please see your local gynecologist so that she or he is able to give you specific therapy depending upon the infection that you have. Do not try to self-medicate, and see your doctor at the earliest. Bye and thank you.